Good day, everyone. I'm Adam, moderator for this webinar. On behalf of the organizer conference panel, I welcome everyone for today's webinar, Safe Opioid Use, Fourth Medication, Blood and Medication Administration Requirements 2021 Update. I'd now like to introduce our presenter for today, Laura A. Dixon. Laura Dixon served as the Director of Facility Patient Safety and Risk Management and Operations for COPIC from 2014 to 2020. Ms. Dixon has more than 20 years of clinical experience in acute care facilities, including critical care, coronary care, perioperative care services, and pain management. I'd now like to hand over the floor to the speaker. Over to you, Ms. Dixon.
Okay, well, thank you very much, Adam, and I'd like to welcome everyone to today's program. As Adam mentioned, we're going to be covering quite a few items for today under the conditions of participation. It has to do primarily with medication administration, but we're going to talk about IVs, and that includes blood administration. You'll hear quite a bit that we're going to talk about and how it involves nursing, because when you think about it, nurses are the ones who are really doing a lot of the administration, whether it's IV medicine, opioids, or even blood. So a lot of this will also touch upon the nursing conditions of participation. So what are we talking about today? Let's start with opioids, because they have been in the news, unfortunately, for quite a long time now, and the epidemic that's been going on with overuse and overdoses and abuse of opioids. And right now what we're finding is that physicians, other professionals, they're facing criminal charges now when patients overdose as a result of opioid uses. And these aren't just minor charges. These are pretty heavy-duty felonies, whether it's murder or manslaughter. So the government is really starting to take a hard look at this. For example, the New York physician who was convicted from death of 6 patients, he's looking at life in prison. An Oklahoma physician charged with murder after 5 patients died. CDC does mention that 90 patients die a day, and that is now one of the leading causes of death. And this is another one where the physician was indicted, and a DEA is also trying to send a message that this is serious stuff. We need to get a handle on it. As far as how OIG, the Office of Inspector General, they see it as fraud and abuse. So let's start off talking overall about the conditions of participation and safe opioid use. Just real briefly, how do the conditions of participation come about? Well, the manual first came out in '86, and there have been, of course, multiple updates since then. They're divided into section numbers, also called tag numbers. The regulations all start in the Federal Register. Acute hospitals, your Appendix A. What we're talking about today are in tags 405, 409, 12, and 957. The majority, again, are in nursing. There's some in pharmacy and actually some in surgery, too. Critical access hospitals, you're in Appendix W. Now, the tag numbers for most, in fact, all of the critical access hospitals changed back in February of 2020. Some of those didn't go into effect until just last month, March 31st of 2021. So like I said, it all starts in the Federal Register. This is how you would sign up to get the emails, and then this is how you would get the manuals. And of course, this is for your critical access hospitals or Appendix W. Same item. There's your transmittal. Those survey certification memos I had talked about. And again, you'll see a lot of these on these two sites had a lot to do with COVID. That's what most of them were. This is what one of those memos look like, that when CMS puts them out. Again, it goes to the surveyors. The nice thing on here is you will see what they change very clearly. And if they do make significant changes, which is when they make changes in the infection control, the QAPI, etc., they actually included all of the information that went in there. So some of these can be quite long survey memos. And of course, the previous one on opioids, and this is the one on critical access hospitals. So let's talk about medication, safe opioid use. CMS, there are pharmacy standards that affect nursing, and that's 490 through 511. Those are the tag numbers. The medication administration is under nursing. They updated the guidance on IV meds and blood transfusions in that safe opioid memo. And also what's the appropriate monitoring that's going to happen, not just during, but also after we give that patient medicine. About Joint Commission. Some of you may be Joint Commission deemed status, and they have pain management standards that talk about opioid administration. Pain management is in leadership. Now, you think it'd go into medical staff or provision of care, but this goes into leadership. There are 7 elements of performance, and what you, of course, have to do is look for a leader, somebody who's responsible for that safe opioid prescribing. Performance improvement under Joint Commission also talks about collecting data to monitor performance. That's an overall, and especially EP number 40. We also not only compile, but we analyze that data, because it doesn't do any good to have a whole bunch of information at our fingertips if we don't do anything. So that's why EP 19 is we monitor the use of them. We track our adverse events. Was it respiratory depression? I'm going to move over to AHRQ, and that is the healthcare research and quality. They have multiple resources on pain and pain management alone, and they put out a brief in October 2019 that talks about treatment for acute pain, and that does include non-medication intervention. So it looks at outcome from a multitude of types of pain, whether it's low back pain, post-op pain, or even dental pain. The National Action Plan for Adverse Drug Reaction and how we can prevent it. This notes opioid is one of the 3 most common errors. And if you're wondering on the others, by the way, insulin happens to be one of them. Health and Human Services, they found 3 classes of meds that are most commonly anticoagulants, diabetic, insulin, and opioid. And even CDC has their own website on overdoses for painkillers. SAMHSA, they have a toolkit that talks about prevention of overdose. This is primarily for your prescribers, but there's also facts in there for your community members and talks about safety advice for patients and families. Again, there's a CDC opioid overdose data website, and then SAMHSA's standards for behavioral health. I'm going to diverse now over to CMS because they talk about opioids, and this is included in what they call the QAPI worksheet, the Quality Assessment Performance Improvement Worksheet. What they found is CMS, and they say this, medication is a shared responsibility of the nursing staff. So that means we have to use a comprehensive system to make sure we're in compliance with pharmacy standards and patient safety requirements are present under our QAPI. That's a major goal for those. The process itself for medication administration, the process has 5 stages. That, of course, always starts with the order of prescribing. Then we have the transcribing and verification. That verification can occur in a couple ways. Administering, and then, of course, monitoring and reporting. 3 time frames that do come up. Those that are time critical. Those you have 1 hour before or after, and those that you have 2 hours before or after. And by the way, this is in the actual manual. This is in the conditions of participation in the nursing section. And then to kind of wrap it up here, we're talking about some CDC opioid guidelines, because CDC really has taken a lot of effort. Now, they're not intended, these are guidelines, keep that in mind. They're not intended to be a regulation. These guidelines, when you are applying them. As far as chronic pain, that's anything over 3 months or past the normal tissue healing time frame. That's when chronic pain can happen, because it could happen. You sprain an ankle, and you end up with complex regional pain syndrome, and that goes on for years. The guidelines give recommendations on when you would initiate and continue opioids for chronic pain. So real quick, other CDC websites, there's those that have the vaccine, the adverse event reporting that can occur from vaccines. There is the link to them, and that will go ahead and wrap up today's program. Well, thank you everyone for attending today's program. We appreciate what you do for folks and for patients, and to stay safe. Thank you.